I'm Molly. I am the president for OTAC, which is Occupational Therapy State Association, the Occupational Therapy Association of Colorado. I work in pediatric home health in my meantime, and I've worked in various settings as well. Jesse, do you want to introduce yourself?
Sure. I'm Jesse Hogan, speech therapy, president of Kasha, and I work up in Northern Colorado. I'm co-owner of three different outpatient clinics, and we serve pediatrics through adults.
Thanks, Jesse. Rebecca?
I am Dr. Rebecca Griffith. I'm the APTA Colorado president, still a new role for me, and I practice primarily in the emergency department, and I'm really happy to be here with you today.
Thanks, Rebecca. Thanks for the next slide, Jesse. Go ahead and take it away.
I'm on my slide game tonight, guys. Okay, so I'm going to start with speech and all of our legislative agenda items that we had this year. As you guys can imagine, it has been a big year for all of the legislative things. So some of the things that we're going to talk about tonight overlap with the three disciplines, and some do not. So we'll try to cover all of it. And I think that we are going to save the questions for the end. So if you guys have any questions as we go through this, please, Rebecca, am I right to write it in and then we will address them when we're done. So for speech this legislative year, we had one big bill that we have been working on. It is the SLPA speech language pathology assistant bill. So prior to this, or still currently, I guess, SLPs were only legally allowed to work in the school districts. Those of us that are in different settings, though, know that that is not happening. There are SLPAs working in all of the settings almost in the state. A lot of people didn't even realize that that was wrong or illegal. So we have been working for the past couple of years to get this legislation passed so that people could legally work outside of the districts. One of the biggest reasons, especially for me, I think, is that we have such a massive shortage. So to be able to open that up will be huge. So we are super, super happy to announce that that bill did pass. We are in the works of getting the language of the bill out to all of our members and everyone in Colorado. So stay tuned. We'll post that on social media, and it'll also go out in our monthly newsletter, and it'll actually probably go out separately as well. So if anyone has questions on that, please don't hesitate to reach out to Kasha. It's not exactly the bill that we were hoping for. There's some things with legislation, or excuse me, regulation, that we're going to have to go back and fix in 2027. But more info to come on that. But super happy that as of January 1st next year, SLPAs can practice outside of the school districts. Another big thing, and this is one that encompasses all three disciplines. I just put it in mine. So for those of you that are in EI, we had a massive scare earlier this year, having to do with their budget, the amount of money that they had to allocate to funds. I'm going to give a huge shout out to all of our lobbyists that worked so hard to jump in and help with this, and avoid what they were trying to do. So I wrote ongoing because as of now, the JBC was able to fund EI. They're going to continue to do that to the best of their abilities. But EI has been very open in wanting to have stakeholder meetings and ongoing meetings to make sure that they can stabilize this program and keep the longevity of it, because it is, as we all know, very, very, very valuable. So that was a big legislative item in working on this year, was to avoid, I'm going to call it a catastrophe because I feel like it would have been, for our EI folks. And lastly, oh my goodness, this one is near and dear to me. So 5 years ago, Megan, I believe, the last time they revised the speech therapy billing manual for Medicaid, somehow in there they added that adults were not able to be seen, adults over 21, for habilitative care unless you were on the ABP waiver and something else. They did not do a good job of telling anyone that, and they did not enforce that. So up until the end of last year, beginning of this year, we all thought that we could see adults, and we were, and they were paying for it. And then all of a sudden they were like, nope, actually you can't do that. So we have been working with HICPUF since last year to get this reversed. It has taken them quite a few months to get it implemented, but finally, beginning July 1st this year, speech therapy is a covered service for all adults over the age of 21, no matter if it's habilitative, or what waiver you're on. You can now start seeing adults again. So that one makes me incredibly happy. So those are the big ones for speech. And I know OT and PT are going to talk about some that continue to overlap. So I will turn it over to you, Molly.
Thanks, Jesse. Thanks for also just giving a quick overview of Town Hall. Completely skipped my mind. And that question and answers will be, or Q&A will occur later. I think most of my legislative agenda is just honestly a big thank you for most people in this collaboration just within this group and for all of our members. We had our DME bill, which is something that we proposed because the physical therapists were the first in the nation to launch it and say that we as therapists should be able to prescribe DME without a doctor's order, which was fantastic. They got that passed last year. We've now got it passed this year with tremendous support from them. And that should be effective on August 6th. We are working to just inform and notify all of our members and practitioners across the state, and are going to work with APTA Colorado as well for that. And then outpatient rate review and the MPPR prevention is something that we all worked on together as well, and just had such fantastic collaboration amongst all three groups to make sure that we did have an impact in these two areas. For the Medicaid outpatient rate reviews, it was looking like we might even get a cut or maybe not get an increase at all. And instead we got a 1.6 rate increase because of all three of our groups and all of our members continuing to show up and write letters and say, hey, this matters to me. I deserve an increase in my reimbursement. So thank you for all of that. And then for the multiple procedure payment reduction, that was something that got proposed as a way to cut costs. And again, with a massive outpouring from all of our organizations and our three organizations working together, we were able to get that removed from the proposed budget this legislative session. So I really appreciate it, and this couldn't have come at a better time. So thanks, everyone. Go ahead, Rebecca.
Hi, everybody. I'm super excited to talk about everything that we did this year. And I know that Molly just talked about the MPPR, but I'm going to talk about it again because it was such a big deal for us this year. I think we went into the legislative session feeling like really optimistic about discussing provider rate increases as we looked at Medicaid, but without really seeing the larger picture, both on the federal level and the state level with our budget deficit. And as the budget was being moved through, MPPR was just sort of slid in there under the impression that it was really a federal issue and that we needed to be consistent with that so that people could, or so that we were consistent with Medicaid, CMS, Medicaid, and Medicare, and that really just wasn't the case. So I think this was the perfect year for the three of our organizations to really come together, because this MPPR, the 8.5% Medicaid cut, truly only targeted physical therapists, speech therapists, and occupational therapists. So there couldn't have been a better year for us to work together. And it took a tremendous effort on behalf of all of our organizations to get that passed. And it really put our advocacy efforts to the test with our advocacy alert system. We had over 2,000 letters sent. And when our state legislators start to get that much noise about an issue, they listen. So what I want you to take away from that is that your efforts mattered. And then as part of the rate review and other Medicaid issues, one of the things that we were really looking forward to at the beginning of the session was getting rid of the physician's signature burden on our Medicaid plans of care. This is no longer required with a Medicare plan of care, so getting this removed from the PT plan of care was really critical to help us avoid spending time chasing physicians when we're autonomous practitioners. So that was passed as of, I think, August 6th or August 1st, maybe. We'll no longer need to have that signature requirement included. And then workers' comp credentialing. This is something that APTA Colorado has had a little bit as like a passion project for many years, but we haven't really been able to get it through. And so this was the year that we were able to make it happen. And so I'm looking for the exact information because I want to make sure I say it correctly. But what this bill does is allows our physical therapists to be credentialed and physical therapist assistants as level one workers' comp practitioners. And Eliza, do you want to say anything more about that? I feel like it's a big thing that will help our practitioners a lot in making sure our workers' comp folks are getting the care that they need.
Yeah, thanks, Rebecca. Hi, everyone. Eliza Schultz, contract lobbyist for APTA Colorado. We have been wanting to get this done for a couple of years, and it's not a super flashy bill, so legislators weren't, jumping at the chance to sponsor it. So instead, we worked through DORA, through their sunset process on the workers' comp program, and met with staff, and they ultimately made this recommendation after we brought it up. It applies to all the disciplines, so it's all licensed healthcare providers. Um, so August 6th, folks can start, if they so choose, it's permissive to get level one accredited, and that is Workers' Comp 101, where to find this form, where to find that form. It's not really scope of practice stuff. But hoping that has more providers participating in the workers' comp program, better access, earlier access for patients, and how that results in better outcomes for your patients. So we're excited about that, and down the road, hopefully we can tie that to better reimbursement for those providers who are credentialed.
Thank you. So we're really excited about that. It's been a thing we've been working on for a long time, and it was really, I think, an unexpected bonus to have that pass this year. And APTA Colorado does plan to have some more information for you on how to go about getting that level one credentialing. Other things that APTA Colorado worked on this year that kind of flew under the radar a little bit are the healthcare ID requirements. And this is going to sound like, well, why is that a big deal? Liza, I'll let you explain why we fought so hard to amend this bill to help protect our other healthcare providers in making sure that this didn't pass as written.
I'm actually going to ask Megan to chime in on this as well, because we were a dynamic duo with a couple of other lobbyists on this particular bill. So Megan did a lion's share of the work. So thank you, Megan, if you want to give it a go.
Sure. Eliza and I have been working on this issue for, is it 2 years now, I think? Um, and, kind of reading the tea leaves and looking at the sponsors and knowing this was going to pass, we were trying to get it in as good a shape as possible and the least burdensome for providers. So the bill is limited to introduction of what your occupation is upon first encounter. You only have to wear a badge if you're in a hospital setting. And that badge is whatever your hospital says is on the badge is on the badge. It's not prescriptive that way. We pretty much narrowed it down to being as least burdensome as it could be. But what I will say is that it was Senate Bill 152. The governor did include a letter that said if this becomes an issue in the future, he'd consider looking at it again, because they don't want complaints at DORA for practitioners for forgetting their badge or it falling off or it's under a sweater, or for you forgetting to introduce yourself in an emergency situation. So I definitely think the governor signed it reluctantly. And so thanks to the work of Eliza and we got it to as good a shape as possible. But do I think it's necessary? Absolutely not. But it's the least burdensome we could get it to be.
Just in contrast, the way the bill was introduced is a sandwich board of all the things you would have to put on your name badge. You couldn't use any abbreviations, so you have to spell out everything. Can you imagine how big your name badge would be? So yeah, the bill came a long way from introduction to what it is now.
The way I was envisioning it is that I would have to wear scrubs that said my full name, my license, my degree, my board certification, my fellowship training, like all spelled out, so that like one of those race t-shirts that has all the like sponsors on the back was how that was going to have to look. So thank you guys very much for helping us with that. The next bill that we really had hoped to prioritize this legislative season was our sports physicals, to allow physical therapists to be able to provide sports physicals for student athletes in Colorado. We did have a bill sponsor for that. Unfortunately, she made the decision to retire, and we were not able to get a late bill sponsor this year. However, this will be one of our top legislative priorities in 2026. We have already secured a bill sponsor, and we'll have it introduced early in the session when everybody is fresh and happy and excited about their lives still. And then finally, other things that we did from a legislative perspective, sort of behind the scenes that I don't think get enough credit, are we worked on our sunset updates. And if you were following along in our last legislative season, we really went through the entire sunset process with our licensure, and many things were changed, including the ability to prescribe durable medical equipment, for example. And the DORA board, the state physical therapy board, usually makes the rules that then go along with that practice act. In the past, we haven't really had a lot of input into that process. So APTA Colorado has been working very hard behind the scenes with our lobbyists to make sure that as DORA goes through that process of setting the rules that go with our new licensure, that we're giving the maximum allowable amount of input into that. And so far, we've been really successful. They've decided not to meet in July, so we hope to be at the August board meeting with letter and plan in hand and ready to go into that next phase of rulemaking. Another piece that I want to mention that came to light during this legislative session was that during the last athletic trainer certification sunset, they actually had removed from their practice act that physical therapists could supervise athletic trainers. They've limited the scope of who can supervise athletic trainers to sports physicians and I think physician assistants and nurse practitioners. So not even any healthcare provider, not any physician. It's very prescriptive and very specific. However, in our PT Practice Act rules, it still says that we're able to supervise athletic trainers. So there is a discrepancy there. We have asked DORA to take action on that, as have the Athletic Training Association. However, they've declined to do that to this point. However, I would encourage you, if you do employ athletic trainers in your practice or supervise athletic trainers, to look at your practice act, their practice act, and what that means for your practice. We are speaking with legal counsel about how to best advise our members at this time, but in the interim, we recommend that you start doing your due diligence about the supervision of athletic trainers in your practice in the state of Colorado. So we are monitoring both the rulemaking process and this discrepancy with athletic trainers.
And can I add one more thing before we go to the next slide? And this is for all three disciplines, and I took it off my slide and forgot to put it back on. So we are still in the process for the outpatient therapy rate review. So that is the 5-year rate review for all three disciplines. So that is still going on. That is an ongoing process all year. I think our next meetings are set for mid-July, and then there'll be 2 or 3 more after that. And we will have the results of that for next year. But that is something that we had talked about in our first town hall. So I wanted to follow up and let you guys know we're still working on that. We're still a part of that. And we'll let you guys know once we get the final results on what that's going to look like. So let me go. Oh, wrong screen. Sorry, guys. Let me go to the next one. All right. Rebecca, you want to give the big thank you?
I do. So first of all, I just want to thank all of our members and non-members who participated this legislative season by sending all of those letters, even just for MPPR. I mean, it was like on average, each legislator received like 30 emails about this one topic, and we could not have done that without you. In addition, we had a number of members come to the Capitol to testify on all of these different things, and we couldn't have done that without you. So we truly, really appreciate your participation this legislative season. We can do a lot behind the scenes, but the decisions are made by the people who show up. So we really appreciate and thank you all for working together and showing up. And I also really want to give a specific thank you to all of our lobbyists. I know specifically, because I'm biased, obviously, the APTA Colorado lobbyists are the best in the business. So I'll let Molly and Jesse specifically thank their lobbyists, but I know our team, Eliza Schultz, Elizabeth Rosen, and Alan Morse, we couldn't do it without you. So we really appreciate all the hard work you put into every legislative season, but especially this one. An 8.5% Medicaid rate cut would have devastated businesses across Colorado and and reduced access to physical therapy services for patients that are the most vulnerable in our state. And I also want to specifically thank my legislative chairs, Tammy Strussel and Chris Edmondson, because your work that no one sees that you do touches thousands of lives, and we could not do it without you. The expertise that you bring, the dedication that you bring, all of the time that you spend. So thank you so much for everything you did to help us be successful this season.
All right, I'll follow that, Rebecca, I guess. Thanks. No, I'm going to echo all of those thank yous. It was amazing to see. And I'm thinking specifically of the EI. I mean, that happened within, gosh, Megan, a week. Right, Eliza? Like that was a week. And the amount of people that wrote letters, sent emails, called people, did all of the things. Truly, you guys, I don't think that we would not have had that outcome had people not shown up and done that grassroots work to make our voices heard, which it was fascinating and amazing to see that it actually does make a difference when sometimes it feels like it doesn't. So it was so thank you. Thank you to everybody. And yeah, Megan, our lobbyist, Eliza, I know you guys are good. Megan, I love you. I am so thankful for you. All of those late night texts, all of the times that we're like, Megan, help us. What do we do? So a huge, huge shout out to you. You have been our champion for years. You've been with us for so long. So thank you for all of your work. And to our board, you guys are amazing. So yeah, those are my thank yous. I really appreciate it, guys.
Oh, to wrap it up. All right. Well, yes, yes. To echo everything that's been said, I am so grateful. Number one, to just this Trialliance group. I think this was just instrumental in making so many things happen this year, especially for OTAC. And of course, to all of our members and those who are not even members, but still sent emails, still read our newsletter and said, oh my gosh, I need to do something. To echo what everyone else has said, it does matter. And these things would not have happened without you doing that. So thank you so much for doing that. We will continue to need you. Please keep reading your emails. It's not over. So please continue to show up, and thank you for all that you've done so far. Our lobbyist, Steve and Tim Coleman, were not able to join us this evening, but they also, with the lobbyists also on this call, have done a huge amount of work. We are so grateful to all of you, and thank you again for just coming together. For those of you who didn't know, all of our lobbyists have come together and started working together to just better support all three groups, which has just been incredible. And I have certainly felt the impact. So I'm so grateful for that. And yes, shout out to our public policy chair, Heidi Kanugi, who again does so much behind scenes, and our executive director, Megan Weber, does a ton and sends out all of the blasts so that everyone knows what's going on and is able to say, hey, we need to rally you right now. This is the time to act. It's all because of Megan. So thank you, everyone. So appreciative, and please just stay tuned as we continue on.
Okay. So we wanted to just quickly kind of wrap this up with some of our upcoming events and then some shared things. So for speech, our annual conference will be, we had a lovely venue change about a month ago. So we will be back at the Pace Center again this year. Thankfully, they're having us back. So that'll be the weekend of October 3rd and 4th. So Molly.
We are having our conference again in Granby from September 11th through 14th. It was a great success last year up in the mountains. Everyone has little tiny homes or trailers, or I think there's even a teepee option. Don't quote me on that one though. But anyways, it was we all had a really lovely time, and so we're going to keep doing that. So we'd love for you to join us.
I want to come stay in the teepee with a bunch of OTs. That sounds like fun.
Please.
Yeah.
While we're just kind of talking about these other things, if you want to put any questions in the chat, we're happy to answer any questions that you might have. The annual APTA Colorado Conference will be held in Golden, Colorado on October 3rd and 4th. It will be Physical Therapy Month, so it's really nice that the speech therapists will be celebrating during Physical Therapy Month as well with their conference on the same weekend as ours. But I do want to also let you know that our elections will be held concurrently. They will be held online, but if you are considering running for a position to get involved with APTA Colorado, please reach out. We're starting to begin that slate of candidates now. And additionally, we will be having a blood drive at our conference because it is PT month. We do want to have PT Day of Service as part of this conference. So we're really looking forward to having you there. We have an amazing lineup of speakers coming for you. So we can't wait to see you at this event.
Rebecca, I promise to give you guys a shout out at our conference. Go PT. Yep. um, all right. So continued collaboration. I think, like we said, this is the first year that we've done this, and we will continue to do this. This has been amazing and I think very, very beneficial. We all have our separate webinars for each of the disciplines. And this kind of goes with this next one of the discounted conference rates, that we have opened that up to all three. So Molly and Rebecca, if you guys want to speak specifically to that, but if you want to come, I mean, PTs, I know it's your month, but you can come hang out with speech therapists. But if you guys, anybody wants to join any of the other disciplines conferences, you get that member rate for that discipline. So we would love to have some PTs and OTs come, even if you just come from, some certain speakers that we have. I think that'd be amazing. And it just shares in that education across disciplines. So you guys jump in on that one if you have more information.
From the OT side, just the same thing. You get the same member discount that you would if you were a member of OTAC, and we'd love to have you. We're really wanting to try and continue to do have presentations and continue collaborating among all three disciplines just in our conferences as well. So feel free to join. You just need to reach out to us and we'll give you that discount.
Same goes for physical therapy and APTA Colorado, but the seed that I want to plant as part of this conversation, while it is too late for this year, I would like to encourage members of OTAC and CASHA to consider applying to present at APTA Colorado conference, either a topic individual to your profession or in conjunction with a physical therapist. There's so much work that we do together day to day that I would really love to see more programming that highlights that celebrates that research and brings that forward. So considering submitting an application next year, we also do have regularly monthly educational offerings, and we'd love to hear from speech therapists and occupational therapists as well as part of that ongoing effort.
Guys, we should do a multidisciplinary panel at each of our conferences.
Love that.
What do you think? Okay. Noted. So the last two, the legislative collaboration and federal monitoring. So that will continue, even though the Colorado session is over for the year. There's still a lot of work to be done, and there's preparation for next year. So we will be doing that on an ongoing basis. And now that's more, just more collaborative between the three disciplines and all of our lobbyists. And shared events, as those come up, we will let you guys know what events we have, and we can go from there. Anything else you guys want to add for collaboration?
I think we're also hoping to discuss the possibility of having a summer pub night for all three of the associations to come together for some networking opportunities.
I love that. Let's make that happen. Guys, we have such good ideas. I love it. Okay, so does anyone, Rebecca, I will let you monitor those questions. Any questions that have come up for us to answer?
So the first question that Eliza's answered is, are there any legislative priorities on the table for next year? Apologies if I missed that already. And so we answered that question from a PT perspective because it was asked by a physical therapist. We're adding physical therapists to the list of providers who can do pre-participation sports physicals. I'd like to just add to that we have kind of a long ideal list of legislative priorities. However, given the drastically shifting federal landscape and how that will impact Colorado's status, we're kind of holding on right now to see how that kind of unfolds over the next several months. Also, in light of knowing that there might be a special session in Colorado later this year. So, more to come on that.
For occupational therapy, we have the same of just waiting. I know I had mentioned in our last town hall that we were talking about moving forward with dry needling legislation. That is still in the works. But as Rebecca said, we are just also waiting to see what continues to happen as the year unfolds and see what might be needed.
Yep. And for speech, we will be working on for 2027, kind of rewriting a little bit of this SLPA bill to fit better what we wanted initially. We had to change that at the beginning due to budget cuts and fiscal notes and things like that. So we will be working on revising that bill, and our sponsors will be the same. They have already committed to helping us do that. Um, I think we're also going to be working for our school SLPs on adding some language just to help them and some of their benefits that they're going to get. So more to come on that. And eventually, I'm going to put this in the universe, guys. You both have DME bills. Someday, speech, we are going to have a DME bill for our speech generating devices, our AAC devices. It's going to happen. I don't know when. It may have to be more of a federal thing first, but it's on our radar. So someday we're going to make that happen.
Love to support you.
Thank you. I know you guys will. Um, so yeah, I think that's it for speech. What other questions?
think
Yeah.
There are no other questions at this time. So if anybody has any other questions, now is your chance. Otherwise, please feel free to reach out to us. We have our contact information here on the screen for you. You can get any information you need about APTA Colorado by using this email address, whether that's information on running for a position, getting involved in a committee, coming to our conference, presenting at one of our educational events. Please feel free to reach out to us at that email address and we'll get back to you right away.
Rebecca, we have a one question in the chat about any updates on the big beautiful bill and how that will potentially
Oh,
affect Medicaid reimbursement.
Eliza, do you want to just answer that?
I will share what I know, and
Great.
Megan, please chime in with what you know. It's still, I think, too early to tell. It seems that the Medicaid cuts or the Medicaid changes that are in the bill do not impact the current state fiscal year. So they may not have to have a special session to address that. So I think it's too early to tell. I will say that I think the populations that are probably um, looking to have modifications are going to be adults without dependent children. So um, for those students, those OT, speech, and PT students, that might be a huge impact to them. It's difficult to say what reimbursement will look like when we don't know what the shortfall will be that we have to cover in a gap. So no more detail at this time, I'm sorry, but Megan, maybe you have more information as well.
No, I was just going to add, I just saw that email from the governor's office related to reinsurance and what's happening at the federal level. Um, I just we will have a lot to figure out outside of even just Medicaid, but reinsurance, the tax credits that people get through the exchange. So it's definitely going to need great minds and great input from providers. Just so it's, it might be great to fix it for the budget for the General Assembly, but we definitely need providers to engage as well as patients.
Yeah, and I will add, and Molly and Rebecca, you guys can add as well, as far as advocacy efforts to help prevent some of these cuts. So ASHA has sent, when it was in the House, they had sent many, many letters to all of the representatives in the House, and now it's in the Senate. It's going to the Senate. So I just got this yesterday from Carolina ASHA. They have a beautiful letter that they are sending to everyone under the sun. And they've asked all of the state associations to sign this. So when we had our board meeting last week for CASHA, we voted that yes, we will sign this. We will be in support with ASHA and the rest of these state organizations to try to stop these cuts. And if you guys receive our monthly e-blast, in that, under the public policy, there are specific links to go to your own senators, and it will generate a letter for you. So it's through ASHA. You just click on it, you put in your address and your name, it will generate a letter and it will send it for you. So back to, again, you guys, our voices matter. So if you want to support defeating these cuts, that is the way to do it. And I know Rebecca and Molly, you guys have similar things.
Yes, for AOTA, which is our national association, they have drafted a letter that anybody, you don't have to be an AOTA member, can sign. If you just type in AOTA Legislative Action Center, one of their many pre-made templates that will also help you find your own legislator. You don't have to do any work besides enter your information. They will help you find your legislator, and also you can send off a number of letters regarding issues that you may be concerned about right now, including the Big Beautiful Bill Act. So please go to AOTA, and we'll continue to inform you the moment that we know something through our e-newsletters. So continue to please subscribe to those and read them every week.
Well, Molly's absolutely right. You don't necessarily need to be an AOTA member or an APTA member to get involved with our legislative advocacy alerts. And even on the federal level, our advocacy center, now is the time to be a member, though. So as we even sit here talking about the potential cuts that could be putting physical therapists out of business, like, now is the time to be an APTA member. When you think about the level of advocacy that we did this year, we're just really starting, right? Like, we're going to be facing really complex challenges over the next several years, and we can't do it without your support. All of these efforts take time, they take money, they take staff, they take systems behind the scenes that handle all of these things. And those of us in these leadership positions are just volunteers doing the best we can. So now is the time to become a member, invest in advocacy, and help support your profession.
Well said, Rebecca and Molly. Thank you. Yeah, Megan, go for it.
I just want to add one thing that Liza and I come across every year when the Medicaid rate changes. You know, when that July 1 hits, I know you all know as providers to watch what the reimbursement should be with the adjustment. But if you see it day one where it's completely wrong, because that happened to speech providers last year, they cut us, even though they're supposed to increase us, just let us know and we'll reach out to Medicaid because it happens every year. It's an individual entering the numbers, so human error, but just let us know.
I think that's a great reminder. Thank you, Megan. Yeah. Okay, Eliza or Rebecca, do we have any other questions?
Nope, that's all we've got.
Okay. Well, thank you again for everybody that could join us tonight. This will be recorded. NPT will put this up through their YouTube channel, so you can share. But we appreciate all of you guys joining, and thank you for everything. We really appreciate it. Okay, have a good night.
Thanks, everyone.
Yeah, thanks.